people think about pelvic floor therapy or hear pelvic floor therapy, they don't realize that there are so many different techniques we use in pelvic floor therapy, which is also why it is considered like a healthcare service. It's not just, you know, doing exercises. It's not personal training, but we are looking at your body as a whole. So we utilize different therapy techniques that we are skilled and trained in to help treat your pelvic floor and the issues that are affecting your pelvic floor function. So when it comes to additional methods and techniques that we use in pelvic floor therapy, we utilize a lot of modalities or manual therapy techniques. Some might be familiar with a few of these items that we have out here, but a lot of people are very familiar with myofascial release. And when we tell them that that is something that we can do, and then we go through the other list of all these other things, then it's like, wow, I didn't realize that I needed that. And then when you actually feel it, you're like, wow, I really didn't realize that I needed it, because it does help significantly to improve your function.
So dry needling, there's kind of two different ways that I utilize dry needling for. One is if you're having pain. So dry needling is great for trigger point release, because those little binds of muscle, if they're just feeling really irritated, and sometimes our hands for trigger point release can't get deep enough that the needle actually goes directly to the muscle we're trying to target. So utilize it for that, and also dry needling can be used in combination with e-stim, not only for pain, but also for motor coordination, meaning how does our brain talk to our muscles to make it work correctly. And so sometimes that can be hard, especially as your body is changing throughout pregnancy and postpartum. And so we can utilize a needle directly to that muscle to teach it, hey, this is how you activate, and then afterwards follow it up with exercise.
And so next, another manual therapy technique and modality that we use is kinesiotaping. Kinesiotaping is great because it provides as an external support as you are going through either pregnancy or postpartum. So a lot of times we use kinesiotaping to support the pelvis and the abdominals. As you're getting this growing weight and pressure onto your pelvis, we actually use the kinesiotape to help hoist and lift up your belly with support, so that way when you go do your exercises that we prescribe you, or any pelvic floor and correlated exercises, daily movement, it can provide you with that additional stability and support. Additionally, with kinesiotaping, it helps so much for our moms, pregnant or postpartum, who have low back discomfort and pain. A lot of times women are not able to complete the exercises because the pain is so debilitating, or they're having so much pelvic heaviness, front, back, or the sides, that it limits their ability to actually do the things that we want them to do. So when we're able to tape our clients before they go home or before they do their exercise, then they usually have much better functional outcomes and ability to do the exercise, because they're not worried or having that pain and discomfort. So kinesiotaping is great for external stability and support, and usually when our moms or clients take the kinesiotape off after using it with movement, they usually feel a lot better than they even did before they had the kinesiotape on.
And it's honestly awesome to follow, like after dry needling and stuff, to follow it up with that kinesiotape, get that like extra, okay, I'm starting to learn what my muscles need to be doing, and help with that pain reduction.
Yes.
Another manual technique that I absolutely adore is cupping. And so a lot of people have seen the glass cupping, where it stays pretty stagnant, really popular after the Olympics. You saw all the big circular bruises. I do it a little bit differently. I think we both do it a little bit differently. This is a silicone cup, meaning it's squishy, it's not glass. And what cupping can be great for is, a lot of times people think, you know, we have like skin and muscle, but really there's lots of different layers in between your skin and your muscle, including fascia. And when we're utilizing our hands, sometimes we can't get that separation of the tissues that the cups can get, which allows a much deeper access to the muscle and brings blood flow to all those different layers. Our skin shouldn't be stuck. We should be able to move everything loose.
Your C-section scars, you should be able to move them around.
And the cup is just a great way to do that.
And cupping is great. Cupping is something that we use a lot, and a lot of people I don't think realize that we can cup like their C-section scars to help us break up the tissue above and below. It is amazing. Literally, I had a client not long ago who just was not able to get rid of that like lower C-section shelf, and there was so much scar tissue there, and utilizing the silicone cups and moving it along the realm that had the scar tissue, within a couple of minutes that pouch, that area was gone, and we were able to get deeper and break up that scar tissue. So utilizing cupping and all of these techniques is really valuable and important to start seeing progress. Sometimes people are not seeing progress in healing their core, healing their pelvic floor after birth, and even during pregnancy, because we're not getting to those root layers that we can only really address with these tools.
The other thing I wanted to say about cupping too is typically at the beginning, you need the skilled pelvic therapy to be able to get you to a certain point. But when people are getting close to graduating, which is such a sad day for me, but also my goal, right, is for you to be able to have these tools for the rest of your life. Cupping and sometimes even kinesiotaping is something that we'll spend a couple sessions training someone in and teaching, so that then you can continue this on more on a maintenance, meaning like as you need basis, and then coming into us if you run into any roadblocks. But that's what I love too, because as much as I love people coming in and kind of tackling those hurdles that might be getting in the way of your healing, ultimately I want you to feel really empowered in your own care, and what are things that eventually you can learn on your own to continue your healing for the rest of your life.
Yeah.
So, yeah, love manual techniques.
Yes, we do. We're big fans of manual therapy techniques. One of the other tools that we love and utilize a lot is the Gradson tool. They come in different shapes and sizes, and they are different depending on what we are targeting and trying to do. So some people, when I whip this thing out, they think it's like a butter knife. It is not. They're smooth edges, but they are created to help us get deeper into some of the tissues. So this one we actually use a lot for feet, plantar fasciitis, which can absolutely affect your pelvic floor and your core function. I utilize this tool so much on the feet and to help break up any tissue, especially for my runners or people who walk on the beach or have just a lot of built up tension. Pickleball players who have tension in their feet. Additionally, we also use the Gradson tool to break up tissue on the inner thighs, quads, hamstrings in a slightly different way. So all of these kind of work together. Sometimes we might use cupping, but other times we might also use the Gradson tool that allows us to target individual strands or lines of fascia that we find. And really, I think it's important too that we don't always use the same manual therapy techniques for every person, because that's part of this individualized care that we provide for our pelvic floor therapy clients, is finding which manual therapy technique works for you.
I love that, because, and I also like grading it too, right? Sometimes seeing all of this can be, whoa, that's a lot, it's overwhelming. It doesn't all come at once. What we're experts in, and especially with that individualized care, is scaling things appropriately. So not going on at once so that you're sore for a week, but kind of slowly building you to different manual techniques, getting you exposure to different things, so ultimately we can have the best tissue healing outcome and it be as comfortable as a process as it possibly can be.
Yes, and we don't ever use all of these at once or in the same session, or honestly in the same treatment plan, but we try to make sure that we gear it toward you, and we may use one or two of these items and then get your body used to it so then we can progress to something else. And lastly, we have the TENS unit, which is something that is really helpful in utilizing for pain management. So our pregnant moms, we have had a few who were in early labor and lived close and were able to come in and utilize the TENS unit while having some other manual therapy techniques done to help them lengthen and relax. And so this is a great tool for pain management and also for those who have a difficult time activating muscle groups. So we utilize this in connection with other manual therapy techniques or other exercises and treatment approaches.
I think the cool thing about manual is it's not that it's all manual or all exercise. It's acknowledging that we need well-rounded care in order to have the best outcomes. And that's okay. It's okay to need a little bit more, like I call it like the TLC, like I'm always like, this is some love on your body.
It feels good once you get past the like, this is uncomfortable and weird and like it's a little painful. Majority of our clients come back and they feel so much better and have so much more progress after that.
And can do better with their home exercise program, which I think is huge, right? How can we assist you in doing the homework you need to do at home to be successful overall? Thank you so much for watching. Be sure to share with your friends.
Like, comment, and subscribe so you can stay up to date on our latest YouTube videos.